in event, the Renal Society, they raise funds for a bunch of different means and events, and these funds help the clients and also help other health causes in Nevis. So the kidneys, again, the kidneys are just two bean-shaped organs in the body. They're about the size of your fist, and they're located in your back. Their function is to filter our blood and to get rid of the waste that we produce in our everyday lives. So the kidneys basically filter the blood, filter water, excess water, and we excrete that as urine. And the kidneys, they have two tubes at their ends which they excrete the urine from, called the ureter. These tubes are attached to the bladder where the urine is stored, and then from there we excrete it to the outside. So also along with that, the kidneys, they function in helping produce red blood cells, which is important for us because that's what we use to carry oxygen and also nutrients and get rid of waste as well. Kidneys control blood pressure, they control the electrolyte balance, which is the salts that we contain within our body that help us function as we do normally. Right. So kidneys, important, they filter and they get rid of the waste. So tonight I want to start by talking about what we call acute kidney injury. Now this is basically any condition that affects the kidney in a negative way that lasts for less than 3 months. Acute kidney injury. It used to be called acute kidney disease, but patients usually recover from any injury they suffer from within less than 3 months. So we had to change it, and we're now calling it acute kidney injury. Now, acute kidney injury occurs in 3 different phases. We have pre-renal, which means before the kidney; intrinsic, which means inside, so inside the kidney; and we also have post-renal, or after the kidney. Now these stages, the definitions, the names, they come from which area of the kidney or which area of the body these diseases or conditions act to affect the kidney. So with acute kidney injury lasting less than 3 months, patients can either recover from the injury and then return to normal kidney function, or if the condition is too far gone and the condition lasts for more than 3 months, then we progress into a chronic kidney disease. Sometimes that's a bit more difficult to come back from. So tonight's session is really important for anybody who may feel like something is wrong with their kidney or have some kind of history of renal illness in the family or within themselves. So let's start with the first aspect of acute kidney injury. So we have the pre-renal stage, which is before kidney. In the pre-renal stage, usually what happens is there's a loss or reduction of blood flow to the kidney. Now this reduction of blood flow to the kidney causes the kidney to become in a shock state where it's not filtering enough blood to create the excretion of the urine. It's not functioning as it should. It's not getting enough blood to filter, so the waste products from all the daily activities we do is backing up into the bloodstream, causing injury to the body. So usually in this state you have things like shock, hypovolemic shock, which is either acute loss of blood or a chronic loss of blood, low blood flow. We also have liver disease. That's one that causes reduced blood flow to the kidney. Constriction of the blood vessels, either naturally or with a toxin. Sometimes we have low volume again in terms of electrolytes and water. Might be sweating too much, might be urinating too much, losing water through vomiting. Anything that causes the body to lose fluid could lead to some kind of pre-renal acute kidney injury. As long as there's a reduction of fluid in the body, there's a reduction of blood going towards the kidney for the kidney to filter the waste products. Now, another thing that also, and very important as well, that also causes this pre-renal kidney injury is excess or inappropriate use of medications. Some antibiotics and some pain medications such as ibuprofen, naproxen, Voltaren, these medications can be harmful for the kidney if used inappropriately. That is either in excess to what is recommended either by the doctor or on the label of the box of the medication that you bought. So that's why we kind of recommend a particular way for patients to take medication, because in excess this medication affects certain organs and organ systems. So excessive inappropriate use of the antibiotics and the painkillers can cause a reduction in blood flow to the kidney, either by constriction or blocking up the filter mechanisms inside the kidneys. In this stage, the usual treatment that can help in the pre-renal stage is either increasing fluid intake in the body, either by IV fluids or by drinking more fluids and electrolytes, if that is possible. Also, reducing the use or stopping the complete stopping of the use of the harmful substance, whether it be toxin, the antibiotics that you use in excess, or the painkillers that you use in excess. Now, stopping these would help reduce the injury done to the kidney in the pre-renal stage, and once the blood flow increases towards the kidney again, then the filtering mechanism can start again and go on as normal. Now, the second stage, intrinsic, which means inside of. So the intrinsic stage, this speaks to damage done to the kidney itself. Now, this damage can occur through two main features. That's either infection or, again, with toxic drugs or substances. Now, with the infection stage now, we're looking at the kidney filtering apparatus, because remember, the kidney filters the blood and uses that to collect the urine that we make. So in the filter stage, if the filter itself is damaged either by an infection of the kidney or by excessive toxic medications that may be harmful to the filter apparatus, this can cause what we call the intrinsic acute kidney injury. Now, it's possible for these filtering apparatus to self-repair if the injury is not permanent and if there's no scarring. So in this case, the best thing would be to stop the harmful substance injuring the kidney, and also to take some medication or methods to reduce the infection in the kidney. The intrinsic isn't that complicated a stage, so not much explanation is needed for that. Either toxic substance or infection. You get rid of either one, the toxic substance or the infection, and the kidney is well on its way to being healed. The next and the last stage of acute kidney injury is post-renal injury. Now, post-renal injury usually speaks to some kind of obstruction in the tubes that lead from the kidney to the bladder or of the bladder itself. Now, urine builds up in the bladder or builds up in these tubes and cause the kidney to not be able to filter anymore and to create any more urine due to the backup. Usually the main cause of this is an enlarged prostate in the male. Now, the prostate is right below the bladder, and when the prostate is enlarged, the bladder is basically choked and the urine can't escape as it should. That's usually why men with prostate illness find it difficult to urinate. The prostate is enlarged and it's blocking the bladder. So now, in a case like that, the best method to reduce the kidney injury done in that form is to unblock the prostate, either through surgical means, medication, or something we call catheterization. Some of you out there might know about. This is when you place a tube inside the penis and the urethra up into the bladder to relieve the urine. Alright, so another case where you might get a blockage causing the kidney to experience post-renal acute kidney injury is a kidney stone. Now, if a stone is large enough and it's blocking the bladder area or the urethra or any one of the ureters, that could cause a backup of urine into the kidney, causing the filter process to slow down or stop. Now, you could always get rid of these stones through medication. If the stone is too big to pass on its own, we can also do surgery to remove it. To me, it's just easier to drink as much water as you recommended, rather than going through a process where you might end up doing a surgery, but that's just me. I think a lot of listeners out there could identify with that as well. So blockages, infections could also cause blockages. Sometimes some individuals, they're born with what we call valves. These valves might be placed inside the ureters or inside the urethra, which is the passage leading from the bladder to the outside. Now, sometimes these valves, they prevent the backflow, but also they cause blockage of urine inside the bladder or inside the kidneys. And that's basically post-renal kidney injury. Simply remove the blockage and the kidney can go about doing its thing as normal. Now, the next thing I want to talk about now is chronic kidney injury. Chronic kidney injury is any reduction in function of the kidney for more than a 3-month period. Chronic kidney disease usually is staged into 5 different stages. These stages are identified by something we in the field call a GFR. This is your glomerular filtration rate. Now, this is basically how much blood the kidney filters in a minute. So we take that measure and we determine how much this individual's kidneys should be filtering in a given minute. And now we look at that measure, we look at the average, and we decide, okay, if you're doing less than your average, you'll be in this particular stage of chronic kidney disease. GFR, we usually calculate that using something called creatinine. This is one of the values you get from doing a lab test when you test your kidneys, usually done in your regular annual panel for lab work. Some things to also consider when doing calculating a GFR to stage someone is the sex, the age, the ethnicity. That's really important. It matters a lot between these things, these values. So now let's jump right into it. Stage 1. Usually stage 1, you could also consider stage 1 to be no kidney disease, because stage 1, your GFR value would be 90 milliliters of blood per minute being filtered by the kidney or more. Now, that's usually the case for most individuals who aren't with kidney injury or kidney disease. They filter more than 90 milliliters of blood every minute with the kidneys. Stage 2 ranges from 60 to 89 milliliters per minute in filtering blood with your kidneys. Stage 3 ranges from 30 to 59 milliliters of blood per minute. Now, stage 3 is important because this is the stage where you usually start seeing symptoms of kidney injury or kidney disease. So you could pass through stage 1, 2, and you never even realize you have any kind of kidney problems or kidney disease until you hit stage 3, which is between 30 and 59 milliliters. In stage 3, you start experiencing fluid retention. You might experience anorexia, which is weight loss beyond explanation. You could experience nausea, vomiting, headaches, dizzy spells, You could feel generally ill. This is because your kidneys are not filtering enough protein, and protein is being backed up in your blood, which causes a dizzy, ill feeling. You may also start developing rashes. You might have decreased liver function, and also you might start seeing your blood levels going low, because remember, the kidneys are responsible for the hormone that helps make red blood cells. So you might develop anemia and increase in that dizziness also. Now at stage 3 you start experiencing these symptoms, and that's usually when we start seeing patients. It's a silent illness up until that point. If you're not doing regular checkups, you would never realize, you would never know until you hit the part where you're doing the symptoms. Stage 4 ranges from 15 to 29 milliliters of blood filtered per minute by your kidneys, and stage 5 is anything 15 milliliters and less. Now, patients usually enter dialysis at different stages, and that depends on how the body reacts to the state it's in. For example, a patient could be in stage 3, but the symptoms they experience are worse or bad enough to help, send them to getting dialysis, either temporarily or permanently. Or a patient might be in stage 4. The symptoms, they might not even recognize the symptoms. The body might be functioning to a level where it could, get through with all of that, and they may never even end up on dialysis. It just depends on the individual. I mean, medicine is a very particular field where it all depends on the patient. The patient is a big factor in any treatment we as physicians give, and we could never not consider the patient, a particular patient, when it comes to recommending treatment or any kind of medication. Now, when you hit renal disease, kidney disease, it's important that you maintain proper fluid balances, you maintain your proper diet. Your diet must change to accommodate for the lack of filtering capacity of your kidney. Now, if your kidneys are injured or there's disease or condition, you obviously cannot filter as normal, so you cannot eat as normal or drink as normal. You must tightly manage what you put in your body, because the filtering process isn't working as well. You also need to take medication to increase your red blood cells. This is usually the hormone. It's an injection that you take every 2 weeks or every month to help the body build up that blood. You must also control your blood pressure very, very tightly. Blood pressure control is one of the most important things when it comes to kidney disease. It's important that you take your blood pressure medication on time, regularly, and as stated. If you miss a dose, you don't double up on your dose, you just take the next dose that you missed. Alright? Another thing of important notice, the most common reason for developing chronic kidney disease is diabetes. Diabetes is the most common thing that leads people to develop kidney disease and end up on dialysis. So tight management of your blood sugar is very, very, very important to not end up with kidney injury or kidney disease. It's one of the most common things I see in long-term diabetics as well. There's always some kind of, especially if it's not managed properly or managed as tightly as it should be, there's always some level of kidney injury. And when I've dealt with certain patients, I've seen them, and over time, if they aren't following the recommendations to the T, you could see the level of creatinine, which is that marker we use to measure the kidney stage. We see it increase ever so slightly over time in the patient's blood results, and that's an indication to us that things aren't really happening as they should. Things aren't going well. So that's an important factor, guys. Anybody out there with sugar in their history, any diabetes, anybody living with the condition, anybody who knows anybody living with that condition, and they're responsible for their care, it's really important to manage that care to not develop kidney disease. The second most important thing, which I find interesting, The second most common factor leading to dialysis and kidney disease is excessive pain medication use. Now, patients often, these medications are available over the counter, which is, it's a touchy subject here and there. But, you get a headache, you get a migraine, something, you go to the pharmacy and you just pick up some ibuprofen. You may or may not take it as you're supposed to. You may take it more than you should. But if you take those medications excessively and in high doses, then you are damaging your kidneys and you may develop some kind of kidney disease and injury over time. Now, it's important because when I was studying in Taiwan, it was almost like neck and neck. Diabetes and excessive pain medication use were about 50-50 in the cases on the dialysis ward. So anybody out there, if you have the habit or the compulsion to go to the pharmacy and just buy ibuprofen or any medication like that just to get rid of pain, that's probably not the best thing to do. And if you do, please take it as it's stated on the box or the bottle that you buy. Okay, it's really important. Keep these kidneys healthy, because once they're gone, they can't come back. The only options after final stages of kidney disease are dialysis or transplant. And right now, we don't have the capacity for transplant. And at this current stage, dialysis is really tough, really expensive. It's basically more than half your life spent doing that, living around that. A lot of considerations to be taken, like I said: blood pressure control, fluid control, your diet has to change, your activity has to change. It's a lot going into dialysis, and I empathize with anybody out there going to dialysis, or anybody living with, taking care of anybody experiencing that dialysis. Now, for the last 5 minutes of this education presentation, I want to get into the tickets for the cocktail and award ceremony that the Renal Society is having on Saturday, December 7th at the Malcolm Guichard Park. So I want to open the lines and also the Facebook Live to anybody who could answer these two questions. Now, like I said, these questions are coming from my presentation tonight, and if you're listening carefully, this should be a no-brainer for you. It should be easy. So you could comment on the Facebook Live or the YouTube Live the answer to win these tickets. It's $150. Trust me, this is one you can't miss. I'll be there. A lot of other people gonna be there. I've seen the tickets sell fast. I've seen them being sold since I first introduced them last month. They've been going really fast, and this is an event that you can't miss. Trust me. So the first question is, when was the Renal Society established? The lines are open for anybody who wants to comment on when the Renal Society was established. That's the question tonight, to win one of these tickets to the cocktail and award ceremony. We have a caller. All right.
So good night.
Good night.
Is it 1999?
Almost. Almost.
2000?
And
2000?
no, not 2000.
Okay.
All right. So we had our first caller tonight. She said 1999 or 2000. Now she's almost correct. She almost won herself a ticket to the Renal Society's cocktail and award ceremony. $150. I mean, a ticket for $150, you must expect a lot of good things to come from that. Dress code for this event is elegant, so everybody coming out in their best. This might be your last chance to dust off that dress you've been itching to wear for a long time. Might be a chance for the fellas to show out. I mean, usually the women are always best dressed, but guys these days we're doing a lot better. So answers for the minute for the night have been 1999 and 2000. Anybody want to take another shot at that? Just call in. My next question, though, let me introduce the next question in the meantime while you think about the first one. At what stage of kidney disease do you start experiencing symptoms? We have 5 stages. Which stage? We have a caller. All right, caller.
Hello, good night.
Good night.
1998.
1998, that's right. Your name, please?
Hermanita Elliott.
Hermanita Elliott. All right, you just won yourself a ticket to our cocktail and award ceremony at Malcolm Gishad on December 7th. You're welcome. So, you got that dress ready?
I'm gone.
Okay then. I'm waiting to, I'm excited to see you there. Alright, so you could come and pick up your ticket at Van Radio.
Thank you very much.
No problem. Thank you for calling and listening.
You're welcome.
Alright. Okay, callers, we just had our first winner for the night. 1998. That's when the Renal Society was founded. Alright. So the next question, again, let me repeat for anybody out there listening. At what stage of kidney disease do you start experiencing symptoms? There's 5 stages. That's 5 chances. That's 20%. Any answer you give, I think that's a good shot for a phone call. At what stage do you start experiencing symptoms? Anybody on the live? Anybody on YouTube? Anybody on Facebook? I mean, we have 1 more minute, so call in and see if you can win yourself a ticket to this beautiful cocktail and award ceremony, December 7th. Might be the last one for the year. All right, we have a caller.
Stage 2.
Which stage?
2.
2? No, almost. Alright, we have less than a minute to go, guys. She said stage 2. That's almost correct. So no, I'm narrowing it down for y'all. If it's almost 2, then it's only 2 options. So 50% chance of winning this ticket tonight. We have a caller? Alright. Caller? Hello?
Hello.
Hi, good night.
Stage 4.
Stage 4, almost stage 4. Almost. So, somebody said 2. We have another one.
Stage 3.
Stage 3, that's correct. Your name?
Pinky.
Pinky?
Yeah.
Alright. We got a correct name for you? Your government
My
name?
name is Pinky Jones.
Pinky Jones. Alright, Pinky Jones, you just won yourself a ticket to the cocktail and award ceremony on December 7th. Congratulations.
Thank you.
Alright, so you could pick it up at Van. And that's it for tonight, y'all. Congratulations again to everybody who called in and participated. Thank you for having me here, everyone. And that is it until next month.
You were just listening to Health Talk, sponsored by Nurse Cherise Harvey in collaboration with the Nevis Renal Society.
It is now 8 o'clock.
This time check is brought to you through the kind courtesy of R.G. Solomon Arcade, situated in the heart of Charlestown. Visit the arcade today for business or shopping pleasure.
With all the power from the tower, this is the powerhouse of the Eastern Caribbean, VON Radio, from the Federation of St. Kitts and Nevis. The views and opinions expressed on the following program are solely those of the participants and do not necessarily reflect the views of the Nevis Broadcasting Company Limited or its advertisers.